Alterations in fluid and electrolytes, pathophysiology, and management. Body fluid is composed of water and chemicals. Electrolytes are substances that carry electrical charge when they're dissolved in fluid, and acids release hydrogen into fluid. Bases are going to bind with hydrogen. The purpose of these components are to regulate fluid volume and to buffer the blood to keep its pH neutral. Most of the body water is intracellular, which is found inside the cell. Extracellular fluid is found outside the cell, and it can be classified as intravascular, which is in the blood vessels, or interstitial, which is fluid that's located around the cells. The human body is comprised of 60% water, and this percentage is affected by age, gender, and body fat. The average fluid intake is about 2,500 mLs per day, and this comes from food and fluid intake, with a similar amount of fluid that's lost through urination. Now, there is an immeasurable amount of fluid that's lost through the gastrointestinal tract, the skin, and the lungs through the breathing process, and this is called insensible water loss. The translocation of fluid and exchange of chemicals, remember those electrolytes, acids, and bases in the body, is continuous, and it happens through 5 different processes. Osmosis is the movement of water through a semi-permeable membrane, and it allows some substances to move into a more concentrated area. The body will attempt to make that concentration inside and outside the cells the same, otherwise isotonic. Filtration also promotes movement of fluid through a semi-permeable membrane, but it's accomplished according to pressure differences, and it determines how the kidneys excrete or absorb fluids and substances. Passive diffusion is the movement of dissolved substances through a semi-permeable membrane from an area of high concentration to low concentration. Facilitated diffusion requires a carrier molecule to help move the substance. And active transport requires ATP, otherwise known as adenosine triphosphate, to push the substance from an area of low concentration into an area of high concentration. Osmolality is the concentration of dissolved particles per kilogram of water. Osmolarity refers to the concentration of particles in body water. The higher the osmolality, the less water, and the higher the osmolarity or concentration of dissolved particles. Survival is dependent upon the body maintaining appropriate amounts and/or distributions of fluid, electrolytes, and pH levels. The body does make adjustments to help keep these things in check, but disease processes or medical interventions have the potential to cause imbalances. This is accomplished by osmoreceptors, which are neurons that are located in the hypothalamus, and they sense blood concentration. If the blood is concentrated, the osmoreceptors stimulate release of the antidiuretic hormone, or ADH, causing the body to hold on to fluid or trigger thirst to gain additional fluid. If the blood pressure or blood volume changes, baroreceptors are stimulated to release or suppress ADH to help maintain that fluid balance. The renin, angiotensin, and aldosterone system are chemicals that are released to increase blood pressure and blood volume through vasoconstriction or reabsorption of sodium. Natriuretic peptides are hormone-like substances that reduce blood volume through excretion of sodium. The ANP and BNP are released when the heart walls are overstretched because of increased volume, and it also increases urine production. So when completing a health history, the nurse should be alert for conditions that can affect the fluid or electrolyte balances. With the vital signs, the fluid volume excess can be exhibited with dyspnea, tachypnea, a bounding pulse, and elevated blood pressure. With fluid volume deficit, this can be exhibited through tachycardia and hypotension. Electrolyte imbalances can cause tachycardia or bradycardia and a weak and/or irregular heart rhythm. Acid-base imbalances can lead to changes in respiratory functions such as slow, shallow respirations or deep, rapid respirations. An elevated temperature can lead to fluid loss and an increased respiratory rate. We also need to look at the intake and output. By assessing these, we can determine whether excessive fluid loss or fluid retention is occurring. In addition to the assessment of the urine color, dark urine will indicate the kidneys are retaining fluid, while light-colored urine indicates diuresing of excessive fluids. Daily weight assessments is an accurate measure of fluid volume changes in the older adults. Body weight can indicate fluid loss or retention. 1 liter of fluid weighs 2.2 pounds. To obtain accurate, comparable body weights, a client needs to be weighed at the same time of the day, wearing the same type of clothing, and preferably before a meal. We can also look at the skin appearance, color, temperature, and turgor, as these also reflect fluid balance. Remember, though, that skin turgor on older adults should be assessed on the forehead or the sternum because of a loss of skin elasticity. Skin with fluid volume deficit can appear dry and flushed with dehydration, but in a really severe dehydration, it will be cool and clammy and pale. The face will look pinched and drawn with sunken eyes, and skin turgor is tinted, although the adult skin is slower to return to normal. Skin with fluid volume excess can appear moist and edematous. The face can have puffy eyelids and fuller cheeks. Edema might be present, and it reflects water and sodium retention. Pitting edema is evaluated on a 4-point scale ranging from +1 edema, which is a barely detectable pit, to a 4+ edema, which is a deep and persistent pit that's approximately 1 inch deep. In severe edema, however, pitting may not even be possible because of the amount of fluid in the tissues. Edema is best determined over the tibia, fibula, sacrum, and sternum. Brawny edema is edematous tissue that feels really hard, such as edema that follows a radical mastectomy. We can also look at the mucous membranes. A tongue will normally have one longitudinal furrow, but with a fluid deficit, there may be multiple furrows apparent, and the mouth can be dry, especially in the cheek and the gum juncture. Realize that a dry mouth may also be the result of mouth breathing or some medications. With sodium excess, the tongue might be red and swollen. We can also look at the veins. Vein filling can be a good indicator of fluid volume. If the jugular veins are visible more than 3 centimeters above the sternal arch, fluid volume excess might be present, but if no distension is present, fluid volume deficit might be present. There's a variety of urine and blood tests available to help determine fluid and electrolyte levels. The urine pH measures hydrogen ions in the urine, and this helps determine how the kidneys are responding to the acid-base imbalances. Urine will be more acidic when it's fresh in the morning. Urine is more alkaline after a meal. Diet is definitely a factor in that a person that consumes a large amount of citrus fruits and vegetables tends to have a more alkaline urine, whereas a person that eats a lot of meat tends to have a more acidic urine. The specific gravity measures urine concentration, fluid balance, and also reflects renal function. A high specific gravity will indicate concentrated urine and fluid volume deficit, but older adults don't concentrate urine as well, and they may have a low or normal specific gravity even when they're dehydrated. Osmolality will measure the number of dissolved particles in a solution, and in this case, it's urine. Urine osmolality will provide a precise measurement of the kidney's ability to concentrate urine. Dilute urine will have a low osmolality, and it generally reflects renal excretion of excessive water. Concentrated urine has a high osmolality, and it generally indicates renal conservation of water, or in the case of renal failure. Urine creatinine clearance is done with a 24-hour urine collection. And to collect a 24-hour urine, we're going to have the client void. We'll discard that first void, and then we'll start the collection when they void the next time. If they miss any urine collection within that 24-hour period, then we will have to dispose of it and start all over again. But we also need to remember that we need to keep this refrigerated or on ice. The 24-hour urine collection will help determine urine kidney function as the urine creatinine clearance, especially at the glomerular level. Urine sodium is going to help show fluid volume status and sodium intake. With a large fluid intake or sodium restriction, these levels are going to fall. The level should be the highest during the day. Urine potassium will measure renal tubular function with a 24-hour specimen. Serum hematocrit is the percentage of blood volume composed of red blood cells. These levels are elevated with fluid volume deficit because of blood concentration. The levels will be decreased with fluid volume excess because of dilution. Serum creatinine is a better indicator of renal function than blood urea nitrogen. High levels will indicate a poor renal function. Blood urea nitrogen provides an indication of renal function also. Fluid volume deficit or poor renal function is going to result in an elevated BUN, and fluid volume excess will result in a low BUN. Serum osmolality will measure how concentrated the blood is. Fluid volume deficit results in a high level, while fluid volume excess will result in a low level. Serum albumin is a plasma protein that helps maintain blood volume. Low levels may result in reduced blood volume and edema because of transfer of fluids into the interstitial compartment. And low serum albumin will allow water to shift into the interstitial compartment, and this reduces blood volume and creates edema. Serum electrolytes are going to be discussed more thoroughly in a different presentation. There's multiple nursing diagnoses that can be used as nursing priorities for fluid and electrolyte imbalances, but the 4 top diagnoses include these that are listed on your slide. The nurse needs to be aware of what fluid and electrolyte imbalances can lead to, and they need to work to prevent them. Complications of fluid and electrolyte imbalances will include death, cardiac dysrhythmias. We know that cardiac or electrolyte imbalances can cause cardiac dysrhythmias. Fluid volume deficit and excess, in addition to dysrhythmias, can affect the cardiac output. A decreased cardiac output and electrolyte imbalances will affect the respiratory function up to and including respiratory failure. And with the neuromuscular complications, we might see confusion or muscle weakness. Daily weights are an accurate way to monitor fluid loss or retention. Be certain to instruct your clients on how to complete daily weights to monitor fluid balance. Weigh them prior to breakfast. Weigh them at the same time every day on the same scale, wearing the same type of clothing. And if they see a weight gain of 2 to 5 pounds in a week, or whatever their physician might deem more appropriate for that particular person, the client should be instructed to call the physician. Instruct the clients on appropriate hydration, and that amount will be dependent on body weight, health status, activity level, and the environment. Assure that clients are aware of dietary resources of electrolytes and what they need to avoid or what they really need to consume to obtain the appropriate electrolytes.